So now we're on to the planet Mercury, and I'm just gonna put this in. Mercury rules Virgo and Gemini. All right, curated both these signs. It's our nervous system, the way we communicate, communication in general, as well as respiration. So Mercury governs neural transmission, cognitive processing, and all communicative systems in the body. And this includes the central and peripheral nervous systems, the lungs and bronchi as air, the mercurial element, the thyroid as metabolic communicator, and the sense organs. So Mercury rules the hands, arms, and shoulders as extensions of neural motor expression. On to primary pathological expressions, such as anxiety disorders, OCD, and dysthymia, which I'm pretty sure my parents have. I know for sure my mom's a Virgo rising, but Sag Sun, and the rest of my family, like my brother's Sun in Virgo, sister's Sun in Virgo. I'm not sure if they have a stellium. I don't know their exact charts, but I noticed this anxiety with Virgo, just this overwhelming panic, underlying overwhelming panic inside of a Virgo native. That just means they have to go, and they don't know when to stop. And then that's where that OCD comes in, and that's why Venus is debilitated in Virgo, because Venus is a planet of communication and romance and having fun and pleasure, and Virgo is more of a let's do business and let's be very try to be professional about the way we communicate, classy. And this could be malefic depending on other placements in the chart. I don't know. I'm talking about Virgo as a natural sign by itself, though. And we also see with Mercury, asthma and reactive airway disease, peripheral neuropathy and neuralgia, thyroid dysregulation, particularly hyperthyroid, carpal tunnel, repetitive strain, and writing cramps. So what I will mention here with these expressions is what we need to understand. Another thing is, when we're talking about the actual essential dignities of these planets and which zodiac signs might fall more subject to certain issues. For example, the sun, we know the sun doesn't do very good in Libra or what? Aquarius. Naturally, they feel detached when someone has these sun placements from reality. Libra just wants to be codependent and in the masses and around people all the time and never alone, while Aquarius is like, I can have my acquaintances and go out to a few parties and do all that, but at the end of the day, do I really need you guys? No. So, and with the moon, we see, where is the moon not very happy? We know the moon doesn't do its best when it's in Capricorn. The planet Saturn created, and we know that Capricorn is a sign of business, classiness, going to work and being there from your 9 to 5, whether it's your 369 in China. That is Capricorn. And Moon does not like Capricorn very well because Moon just wants to be fluid and go along with the tides, while Capricorn says no, we have to work to make money. So there is no sleep, there is no break, there is no, So this is what we see with that Moon and Capricorn individual. On the Mercury, and this is how it all ties in, is I have Mercury and Pisces debilitated. And what I was going to say is, with how much I smoke, and ever since I was a kid, I've had anxiety disorders. But thyroid dysregulation, I'm noticing more of a particular issue possibly with those that have Mercury debilitated. And that would be those of us that have Mercury in Pisces, which is, of course, its detriment, it's fallen, but also Sagittarius, which honestly, Mercury can work better in Sag than with Pisces, because Sagittarius will tell you how it is. Pisces can also tell you how it is depending on placements, like the ascendant, but Mercury in Pisces is more like, I want to be able to defend myself. I just don't know how to defend myself without feeling like I might get physically attacked. And so I need to learn how to physically defend myself. But I feel like I'm clumsy in some ways of self-defense. I don't know if that makes sense. I have been previously in the past. So, on to Venus. That's where I was getting at. Kidneys, it's our skin, it's our throat, and reproductive harmony. If you guys hear any noise in the background, I'm very sorry because I'm in my Section 8 apartment. So, Venus rules the venous circulation. Okay? The kidneys as filters of the blood, the parathyroid glands, the skin as a surface of beauty and exchange, the throat, and the reproductive system in its harmonious relating aspect. Venus governs copper metabolism, the acid-base balance of the renal tubules, and the beauty of form and physiological symmetry. So we can understand here with Venus, we see usually kidney stones and chronic renal insufficiency, polycystic ovarian syndrome and endometriosis, venous insufficiency and varicose veins, eczema, psoriasis and skin conditions, parathyroid disorders, and calcium dysregulation. Okay. We know Venus curated Libra, Taurus, but it doesn't do so hot when it's in Virgo. And when it's in Pisces, you can say it doesn't do so hot because I have this placement and I've only been abused, cheated, manipulated, dealt with repressed homosexual men, men that mock me, my ideas, my beliefs. So is Pisces exalted with Venus? Who knows? Depends who you ask. Technically, yes, but I have this placement, and maybe it's, you can say other planets are afflicting it, but... So Mars is our muscles, inflammation, and adrenals. Mars governs the muscular system, the immune system's inflammatory response, the adrenal cortex and medulla, the gallbladder, the red blood cells, iron metabolism, and the male reproductive system. Mars represents the sympathetic nervous system and the fight-or-flight response. Martian pathology is typically acute, inflammatory, and febrile. So we see with Mars, our primary pathological expressions are acute febrile illness and inflammatory conditions, adrenal excess, Cushing syndrome, adrenal fatigue, iron deficiency, anemia or hemochromatosis, as well as muscular injury, rhabdomyolysis and myalgia, aggressive prostatitis, urogenital infections. All right. So we know Mars curated Scorpio. And we also know that Mars is exalted in Capricorn. And it falls, or doesn't do the best, when it's in Cancer. Alright. Jupiter is our liver, growth, and immune expansion. Okay? Jupiter governs all expansive, proliferative processes. The liver as the body's great metabolic engine, the arterial blood, growth hormone, and IGF-1. The adipose tissue as an endocrine organ and the immune system's humoral response, B cells, and antibody production. Jupiter rules the hips, thighs, and the sciatic nerve, as well as the liver, but we already said this. So we usually see hepatomegaly, fatty liver disease, cirrhosis, type 2 diabetes, insulin resistance, metabolic syndrome, benign tumors and lipomas, excess growth, immune excess, allergies, hypersensitivity, autoimmunity, as well as sciatica and hip joint pathology. With my mom being a sun in Sag, who is curated by this planet, as well as me being Pisces, my mom actually has struggled with sciatica nerve. And I've actually seen a lot of guitar players that have Sag sun complain about their hands hurting. So, but that's more Mercury, right? So Saturn is our bones, structure, and chronicity. Saturn rules all structures that give the body form and boundary. The skeletal system, cartilage, tendons, the skin's dermis, the spleen, the gallbladder, bile ducts, and the vagus nerve as governor of parasympathetic tone. Saturn represents chronicity, illness that hardens, restricts, dries, or limits. Could be all of the above. Saturn pathology tends toward deficiency, sclerosis, and atrophy rather than excess. Excuse me. So we can see our PPE for Saturn is what we'll just keep calling it that. So for Saturn, we see osteoporosis and osteoarthritis, chronic degenerative disease, Parkinson's, and multiple sclerosis. Dental caries, periodontal disease, depression, chronic fatigue syndrome, as well as gallstones and bile duct stricture. Alright, on to Uranus, the nervous system disruption and sudden change. So the modern planet Uranus is associated with the higher nervous system, neurological disruption, as well as spasmodic conditions and sudden onset disorders. Uranus corresponds to the electrical activity of the brain, epilepsy, EEG abnormalities, the autonomic nervous system dysregulation, and conditions characterized by unpredictability and intermittency. So we usually see with Uranus epilepsy and paroxysmal neurological disorders, cardiac arrhythmias with unpredictable onset, ADHD and neurodevelopmental conditions, sudden accidents, fractures and trauma, spasmodic conditions, Tourette's, tetany, fasciculations. Excuse me. I am learning more as I go about this. So Neptune, we see its immune sensitivity, sleep, and dissolving boundaries. So Neptune governs the lymphatic system, pineal gland, sleep architecture, solar immune response, and conditions where boundaries dissolve. Autoimmunity, self-attack self, infection by invisible agents, and chemical sensitivities. Neptune also rules anesthesia, psychotropic substances, and the dissolution of cellular identity, seen in cancer metastases. So we usually see with Neptune multiple chemical sensitivity and environmental illness, chronic Lyme disease and post-viral syndromes, sleep disorders, insomnia, sleep apnea, narcolepsy, autoimmune conditions of subtle or confusing presentation, addiction disorders, and psychedelic states. Which, in my opinion, when we talk about addiction, it's really, are you drinking, smoke? I don't know anyone that does anything else, but there are people. Pluto is the planet of transformation, death, and regeneration, rules the deepest transformative processes, cellular death and regeneration, apoptosis and mitosis, the elimination of metabolic waste, reproductive organs at their most primal level, colon, and the immune system's capacity for radical transformation. Pluto pathology represents the most profound systemic challenges: cancer, genetic disease, and encounters with mortality. Cancer, particularly of the reproductive and eliminative organs, genetic disorders and rare diseases, severe infection requiring radical intervention. Colon pathology, diverticulitis, colon cancer, profound immune collapse, AIDS, severe aplastic anemia. Alright, we're on to part 2 now, which is our advanced diagnostic techniques. So I actually wanted this to be longer than 39 pages, to be honest, but I'm glad that I can get some other content out as well. So let's talk about the natal chart as a health map, and then we're going to get into the 4 angles as vital indicators. So the natal horoscope, is cast for the precise moment and location of birth, constitutes the foundational document of medical astrological assessment. It encodes constitutional predispositions, systemic vulnerabilities, and the timing of activation of latent health patterns. The practitioner reads it not as a fixed destiny, but as a probability landscape, a map of tendencies that clinical intervention, lifestyle medicine, and self-knowledge can modify. So we have the 4 angles as vital indicators. We have the ascendant, the first house cusp, the physical body, constitution, appearance, vital force, and the way the individual presents to the world. Planets conjunct the ascendant within 8 degrees are critically important constitutional modifiers. Midheaven, 10th house cusp. Vitality in relation to career and public life. Planets on the MC or midheaven often manifest as chronic conditions that become prominent in midlife. Descendant, 7th house cusp. The open enemy of health, conditions that arise through relationship stress, projection, or immune dysfunction, the self-other interface. And immune coli, the 4th house cusp. Hereditary constitutional factors, chronic hidden illness, conditions that arise from the roots, genetic, familial, or psychosomatic. Okay? Now let's talk about assessing vitality with the highlight in alkocodon or alshocodon. So essentially, classical medical astrology devised sophisticated methods for assessing the quality and duration of life force. The heilig, from the Greek heil, primal matter, is the planet or point designated as the giver of life. The alshocodon is its dispositor, the planet that gives years. Together they constitute a system for understanding the individual's vital reserve and constitutional resilience. So the heilig may be the sun, if in a masculine sign, and above the horizon in a day chart, for example, like Leo, and you were born at like 7 a.m. Could be the moon, if it's in a fertile sign in a night chart. So for example, Cancer, it's home sign, and you were born at, let's say, 8 o'clock at night. The ascendant degree, fall back when neither luminary qualifies, could also be the part of fortune in some classical authorities, as well as the prenatal new or full moon degree, Bonetti's method. Okay. So, we got the Lord of the Ascendant in medical analysis. The ruling planet of the ascending sign serves as a co-significator of the body. Its house position, aspects, dignity, and any applying afflictions all contribute to the health picture. A debilitated Lord of the Ascendant in detriment or fall, besieged by malefics or in a cadent house, indicates constitutional weakness and a need for tonification strategies. A well-dignified, angularly placed Lord of the Ascendant indicates robust constitutional resilience. Alright, we're on to the Ascendant and Physical Constitution in Chapter 6, where clearly we have the Ascendant or Ascendants, all 12. And we also have our constitutional profile, physical description for the Ascendants. Alright, so we're 6 through 8. So we see Aries rising, Taurus, Gemini, Cancer, Leo, Virgo, Libra, Scorpio, Sag, Capricorn, Aquarius, Pisces. Alright, so Aries rising. We see medium muscular build, florid complexion, prominent brow, quick movement, hot, dry temperament, prone to head injuries and fevers. I go as far to say brain injuries, whether it's a stroke or a lobotomy, even. Lobotomy is Aries. That incision, that cut, is Mars. Taurus, sturdy, thick-necked, and you can tell with my Taurus rising, I have that exogenous testosterone Adam's apple in my throat. And I also have Algol conjunct my ascendant. So, of course, in Mercury and Pisces, debilitated. So my natal promise to sound the way that I sound. I'm fine with it. So, Taurus, full lips, pleasant features, tendency to weight gain, cold dry, vulnerable to throat and thyroid conditions. But does big pharmaceutical care? No, they don't care. They want money. Gemini rising, tall, slender, quick eyes, animated expression, nervous energy, hot, moist, respiratory weakness, nervous exhaustion risk. Okay? And this all depends on your actual natal chart. We're just going based off of what we hypothetically would see archetypally with the signs and the ascendants. Cancer rising, round face, large eyes, pale or changeable skin, fluctuating weight, cold and moist, digestive sensitivity, emotional somatization. Leo rising, commanding presence, strong back, thick hair, leonine face, hot, dry, cardiac risk in later life, spinal issues. Virgo rising, delicate features, analytical expression, may be thin or wiry, cold, dry, digestive hypersensitivity, anxiety, perfectionism, related stress, illness. I see that with my mother, is that perfectionism related stress, illness. She's always trying her hardest, and it's never enough. It seems like this world, nothing is ever enough for the world because we all have to die and play our part while we're here. Libra rising, symmetrical, attractive features, well-proportioned, pleasant manner, hot, moist, kidney tendency with lumbar weakness, as well as hormonal balancing challenges. What we see with Scorpio rising, intense gaze, strong constitution, magnetic presence, dark coloring, cold, moist, reproductive, and eliminative system vulnerability, depth of disease. Sag rising, tall, athletic or expansive build, optimistic bearing, broad hips, hot, dry, hepatic and sciatic predisposition, excesses in diet. Capricorn rising, lean, bony structure, reserved expression, ages gracefully, cold, dry, skeletal, dental, and depressive vulnerability, chronic conditions. Aquarius rising, distinctive appearance, intellectual bearing, long limbs, hot, moist, circulatory and neurological predisposition, spasmodic conditions. And Pisces rising, soft features, dreamy expression, fluid build, paler watery eyes, cold, moist, immune sensitivity, lymphatic congestion, psychosomatic tendency. All right, moving on to chapter 7. The 6th house, illness, hygiene, and service. So the 6th house is the primary house of health challenges in natal astrology. Traditionally associated with servitude, daily routine, and small animals, its medical significance lies in chronic recurring conditions, occupational health, diet and hygiene practices, and the body's response to daily stressors. Planets positioned in the 6th house carry strong pathological significance and deserve thorough clinical assessment. So now we are going to look at planets in the 6th, and we're looking at our clinical implications here. And this is where it gets really fun, because you can just find out in your chart, literally anytime, where is my planets in the 6th house. So, with Sun in the 6th house, we see chronic vitality depletion. Health is a central life theme. Cardiac considerations. The identity may become enmeshed with illness. Naturally. Moon in the 6th. Emotional somatization. Digestive and hormonal fluctuations tied to the emotional state. Diet strongly affects the mood and vice versa. Mercury in the 6th. Anxiety-related illness, nervous digestive conditions, hypochondriac tendency, benefit from analytical approaches to health. Venus in the 6th, kidney and renal conditions, dietary excess, skin conditions related to sugar metabolism, benefit from aesthetic health practices. Mars in the 6th, inflammatory and febrile conditions, occupational injuries, adrenal stress, benefit from vigorous physical activity as medicine. Jupiter in the 6th, that color is way too different. Hepatic and metabolic conditions, obesity risk, Benefit from moderation, generous immune response, but excess is the pattern. Saturn in the 6th is chronic deficiency pattern illness, restricted vitality, bone and joint issues, highly disciplined health practices indicated. Okay? And then we see Uranus in the 6th. Erratic health patterns, unusual diagnosis, benefit from alternative medicine, spasmodic or sudden onset conditions. Neptune in the 6th. Immune sensitivity, misdiagnosis risk, chemical sensitivity, benefit from subtle therapies, psychosomatic contribution to illness. Pluto in the 6th is transformative health crises, potential for profound healing, elimination, and detoxification issues, as well as occupational toxin exposure. All right. Moving right along. So, chapter 8, we're going to talk about the 8th and the 12th houses in pathology. Now, while the 6th house governs everyday illness, the 8th and the 12th houses represent deeper, more profound, and often more obscure dimensions of pathology. Beginning with the 8th house, crises, surgery, and transformation. The 8th house governs life's most profound transitions, whether it's surgery, near-death experiences, regenerative crises, conditions requiring radical intervention. Planets here, or the ruler of the 8th house in challenging aspect, may indicate surgical intervention, inherited disease patterns, particularly through the father's line, traditional doctrine, or the quality of physical regeneration and recovery. The 8th house also rules inherited genetic material, the karmic debt encoded in the double helix. The 12th house of hidden illness and chronic confinement. So the 12th house is traditionally the house of hidden enemies, confinement, and self-undoing. In medical astrology, it governs conditions that are difficult to diagnose, immune system disorders where the enemy comes from within, hospital environments, long-term convalescence, mental health conditions requiring inpatient care, the psychic or emotional roots of illness. Neptune in the 12th, its natural domicile, amplifies immune sensitivity and psychosomatic tendencies. Saturn here creates a pattern of chronic hidden burden, often manifesting as fatigue states, fibromyalgia, or long-term mental health challenges. Part 3, we're going to talk about pathology and disease signatures. So, page 20, I just want to make sure we actually have references too. Okay, I think we do. Alright, cool. Oops. Alright, so this is where we were. Planetary afflictions and disease patterns. An affliction in classical astrology refers to a planet under stress, whether it's in detriment or fall, besieged by malefics, receiving hard aspects, conjunction with Mars or Saturn, square or opposition from malefics, or placed in a Ketan house without reception. Afflicted planets do not function optimally in their physiological rulerships and tend to express pathology in those systems. Mars-Saturn configurations, chronic inflammation, and obstruction. So the conjunction, square, or opposition of Mars and Saturn represents one of the most clinically significant planetary pairs. Mars drives inflammation and immune activation. Saturn creates restriction, obstruction, and chronicity. Their combination may produce conditions characterized by inflammatory processes that fail to resolve, chronic inflammatory bowel disease, rheumatoid arthritis with permanent joint damage, obstructive uropathy with secondary infection, or inflammatory conditions accompanied by calcification or fibrosis. It has Sun-Saturn aspects here, vitality restriction, and I had a thought to myself. Why am I even making this video? Why have I wasted so much time on YouTube and all of us when the government can easily take this down yesterday? There is no YouTube. It got out of control. There is no YouTube. I'm just waiting for it to happen. And I know a lot of people are. And then there's people like me that get no views and only have 119 subscribers and no money, and we're 21 years old, and we're asking why. Why didn't we get a chance? But I'm going to keep making the video. It's my Mars and Capricorn. So, Sun, Saturn aspects, we're talking about vitality restriction here. So hard aspects between the Sun and Saturn indicate a constitutional tendency toward vitality restriction. These individuals must work harder for health and may have structural cardiac issues. The Sun's domain restricted by Saturn's limitation. Bone density and dental health, which is Saturn, may be compromised by poor calcium metabolism. Psychologically, a Sun-Saturn affliction often correlates with depression as a complicating factor in physical illness. Okay? Moon-Neptune configurations, immune confusion. So when the Moon, ruler of fluid systems and hormonal cycles, receives difficult aspects from Neptune, the result is often immune system confusion. The boundary between self and non-self becomes unclear, predisposing to autoimmune conditions, allergic states, and environmental sensitivity. These individuals are also prone to fluid retention, lymphatic stagnation, conditions where diagnosis is elusive because symptoms shift and dissolve like the Neptunian archetype itself. Okay? Now I want to go over this complete planetary affliction reference with you guys. Looking at the planetary pair, type, and potential health expression. I should just use pink. Alright, oops. There you go. So, we see Sun Mars, Sun Saturn, Moon Mars, Moon Saturn, and Moon Neptune. What do we know with Sun Mars? We know there's a few types that you need to worry about and watch out for. Conjunction, square, opposition. Okay, easy. And then we see our PhD is what I'll call it. A potential health expression. So febrile illness, hypertension, cardiac inflammation, burns, accidents, excessive drive, depleting vitality. Sun Saturn, square opposition, look out, constitutional weakness, depression complicating illness, cardiac restriction, and bone disease. Moon Mars, all hard aspects, gynecological inflammation, stomach ulcers, anemia, emotional inflammatory triggers. Moon Saturn, square opposition, hormonal suppression, hypothyroidism, cold uterus, emotional repression to somatic symptoms. Moon Neptune, we see conjunction square, autoimmune, lymphatic disorders, chemical sensitivity, as well as fluid dysregulation. All right. So Mercury Mars, we look for squares, oppositions, and we see inflammatory neuropathy, tension headaches, speech disorders, anxiety with insomnia. Mercury Saturn, all hard aspects, chronic anxiety, melancholic depression, peripheral nerve damage, and thyroid suppression. Venus Mars, opposition, square, reproductive inflammation, urinary infections, adrenal gonadal axis imbalance. Venus Saturn, square opposition, renal insufficiency, parathyroid dysfunction, calcium loss, relationship stress, somatic symptoms. Jupiter Saturn, conjunction, opposition, hepatic splenic imbalance, metabolic syndrome, expansion versus restriction, immune conflict. Mars Pluto, square opposition, severe inflammatory cascades, immune dysregulation, surgical emergencies, hemorrhage. Saturn Neptune, conjunction, square, chronic fatigue syndrome, fibromyalgia, immune suppression and chronicity, obscure degenerative illness. Saturn Pluto, conjunction, square, serious chronic disease, cancer predisposition, the most challenging constitutional signature. All right? So that tells us quite a bit here. Then we have our aspect patterns in chronic disease. Beyond individual aspects, complex multi-planet configurations create holistic pathological pictures that no single planetary pair can capture. First is a T-square. We see our configuration and the health expression, and then onto the Grand Cross. And this is what I really appreciate about this AI tool, is that it's able to be very teachable or educational. So with the T-square, we know it's two planets in opposition, both squaring a third, the apex planet. The apex planet receives the tension of the opposition and becomes the primary focal point of stress, physiological and psychological. The apex planet's ruled body system becomes the primary site of chronic dysfunction. A T-square with the apex on Mars and Scorpio in the 6th house creates a chronic pattern of reproductive, eliminative, inflammatory conditions, recurring infections, and adrenal dysregulation. Okay? For Grand Cross, 4 planets at approximately 90-degree intervals, forming 2 oppositions and 4 squares. A complete Grand Cross is one of the most challenging natal configurations for constitutional health. The cardinal Grand Cross activates multiple organ systems simultaneously under stress. The fixed Grand Cross creates deeply entrenched, difficult-to-shift chronic disease patterns. The mutable Grand Cross produces dispersed, systemic, hard-to-diagnose conditions affecting multiple body systems concurrently. Grand Trine, 3 planets in trine, approximately 120 degrees apart, all in the same element, often considered fortunate, but in medical astrology can indicate excessive ease. The body takes the path of least resistance. Health expression. Grand trine in water signs may indicate lymphatic stagnation, immune complacency, and fluid excess. A grand trine in earth may indicate metabolic sluggishness, structural density. The body's self-regulatory mechanisms may be too passive. And a Yod, finger of God. 2 planets in sextile, both quincunx 150 degrees to a third apex planet. The quincunx is associated with health adjustments, minor ailments, and the need for recalibration. The apex planet of a Yod is under constant subtle pressure for adjustment. This often manifests as a health condition that requires ongoing management and lifestyle adaptation, rather than a single curative intervention. The body perpetually seeks a homeostatic equilibrium that remains elusive. Okay, we're gonna pause at chapter 12 and then I'll merge. I gotta take a quick food break. But first, let's talk about chapter 11, nodal axes and karmic health patterns. Okay, and I've talked about Rahu and Ketu before on the channel. So they represent the axes of evolutionary growth and release. In medical astrology, they indicate inherited health patterns and the body's developmental trajectory toward greater vitality and wholeness. Okay? So the south node conjunctions are Ketu. Planets conjunct Ketu carry patterns from the past, whether understood as ancestral genetics, early childhood conditioning, or past life residue, depending on a practitioner's metaphysical framework. A planet conjunct Ketu in a health sign, 6th, 8th, 12th, indicates deep-seated, hard-to-shift health patterns that require the full repertoire of integrative tools, constitutional herbal medicine, nutritional therapy, psychotherapeutic processing, somatic bodywork, and I actually have Ketu in the 6th, with Rahu in my 12th. I'm a detransitioner. So we're going to go over this quick nodal axes by sign ancestral health polarities here. So we look at Ketu, which is release, and Rahu, which is deemed growth, and we look at the key health polarity here. So for Aries, Ketu in Aries, that means Rahu is in Libra. If you have Ketu in Taurus, Rahu is in Scorpio. Okay. So for Aries, Ketu and Libra, Rahu, we see release aggressive self-assertion, cultivate relational balance and renal health. Ketu in Taurus, Rahu and Scorpio release material accumulation, develop capacity for eliminative cleansing and regeneration. Excuse me. Ketu in Gemini, Rahu and Sagittarius release scattered thinking, develop philosophical grounding and hepatic vitality. Ketu in Cancer, Rahu and Capricorn release emotional eating, develop structural discipline and skeletal health. Ketu in Leo, Rahu in Aquarius, release performative identity, develop systemic circulation and collective health awareness. Ketu in Virgo, Rahu in Pisces, release overanalysis and worry, develop lymphatic release and immune trust. Okay. And now, progressions in solar arc directions and illness. So, we're going to talk about secondary and solar arc. Predictive techniques is what they're called, predictive techniques. In medical astrology, we allow the practitioner to identify windows of heightened health vulnerability and equally periods of peak healing potential. Secondary progressions and solar arc directions are the two most clinically reliable predictive methods. In secondary progressions, 1 day of ephemeris time after birth equals 1 year of life. The progressed chart moves slowly, with the progressed moon completing a full zodiacal circuit approximately every 27.5 years, making it the most useful progressed timer for health events. The progressed moon changing signs indicates a shift in the body's constitutional emphasis. The progressed moon conjuncting natal malefics such as Mars, Saturn, Pluto, or Ketu in health-related houses is a classical trigger for illness onset. In solar arc directions, every planet moves forward by the same arc as the sun has progressed, approximately 1 degree per year. Solar arc planets contacting natal health significators, rulers of the 1st, 6th, 8th by conjunction or hard aspect mark significant turning points in health. Solar arc Saturn conjunct the natal sun, approximately at age 28 to 30 for many, often coincides with the first significant constitutional health reckoning, the body's first major checkpoint. Part 4 is therapeutic timing and electional medicine. And it's just looking like until chapter 16. Okay, so from chapter 13 through 16, it's just 4. We'll go over 13 here really quick. I am so fucking hungry. Transiting planets, their current positions in the heavens, interact with the natal chart to trigger Latin constitutional patterns. In medical timing, the practitioner watches for transits of the outer planets, whether it's Saturn, Uranus, Neptune, or Pluto, to the natal ascendant, Sun, Moon, 6th house ruler, and any natal planet in the health houses. Okay? Saturn transits, the great examiner. So Saturn transiting the natal ascendant, or the Sun, typically manifests as a significant health assessment period. The body undergoes a pruning. Chronic conditions come to attention. Vitality is temporarily reduced. The immune system may require support. This is an ideal time for a thorough constitutional health assessment, preventive screening, and the implementation of long-term health protocols. Saturn transits last approximately 12 through 18 months and demand patience, discipline, and systematic therapeutic approach. On to solar and lunar returns and medical timing. Solar return chart. Cast for the exact moment the sun returns to its natal position each year, sets the health theme for the following 12 months. Planets in the solar return 6th, 8th, or 12th houses indicate health-relevant themes for the year. The solar return ascendant indicates the body's dominant constitutional mode for the year ahead. Monthly lunar return charts, cast for the moon's return to its natal position, approximately every 27.3 days, provide finer-graining timing for health interventions, treatment windows, and the anticipation of symptomatic flares and cyclical conditions. Critical transit windows, reference table here. Right, so just a couple to go over that are pretty critical. So Saturn conjunct the ascendant, 12 through 18 months, constitutional reassessment, immune vulnerability, the body demands restructuring, full health audit, long-term protocol establishment, bone density screening. Saturn square the sun, 12 through 18 months, vitality restriction, cardiac attention, paternal health patterns activate, cardiovascular screening, energy management, and reduce overwork. Pluto conjunct the sun 2 through 4 years, profound health transformation, potential for serious illness or radical healing, deep detoxification, psycho-oncological support, transformative health practices. Neptune conjunct the ascendant 18 through 24 months, immune sensitivity, misdiagnosis risk, psychosomatic amplification. Seek multiple medical opinions, avoid immunosuppressants without careful consideration, spiritual healing practices. Uranus conjunct the ascendant 12 through 18 months, sudden health changes, neurological shifts, benefit from alternative medicine. Safety review, neurological baseline, openness to unconventional therapies. So we have a lot of good Critical transits to remember here. Whoa. Our duration, our medical significance. We have it all right here. And Jupiter conjunct the sixth cusp, usually 2 to 3 months. Expansion of health themes, metabolic increase, potential benefit from treatment. Excellent for initiating treatment, weight management, attention, hepatic support. Mars transit the sixth house, 2 through 4 weeks, inflammatory flares, febrile episodes, immune activation, anti-inflammatory dietary support, rest, and monitor temperature. Oh, and chapter 14 is its own page. Okay, I did not know that. So the moon's influence on biological tidal rhythms, fluid dynamics, and immune function has been observed clinically for millennia. Modern chronobiological research has begun to validate the association between lunar phases, circadian rhythms, hormonal cycles, and perioperative outcomes. We're going to look at moon phases and surgical timing. The clinical note here says the traditional rule that surgery should be avoided when the moon transits the sign, ruling the body part to be operated upon. For example, avoiding abdominal surgery when the moon is in Virgo or Cancer has been recorded by practitioners from Culpeper to contemporary medical astrologers. While randomized controlled evidence remains limited, this principle is worth considering in electional planning. So we're obviously going to look at our lunar phase, physiological quality, and surgical recommendation. So, our new moon, we see it's the lowest fluid tide, tissues least odematous, beginnings of regeneration, favorable for surgery, requiring minimal bleeding, avoid if immune support needed. Waxing crescent the first quarter, building fluids, tissue vitality increasing. Initiate long-term treatment protocols good for tonification therapies. First quarter, fluid momentum increasing, hormonal building, moderate, balance between too dry and too moist. Waxing gibbous, fluids building strongly, tissue plumpness increasing. Okay, good for healing therapies. Avoid major surgery if swelling risk increases. Full moon, peak fluid tide, maximum tissue congestion and bleeding risk. Avoid elective surgery, excellent for acute healing, drawing out and release therapies. Waning gibbous, fluids beginning to recede, metabolic activity still high. Initiate elimination and detoxification protocols. Last quarter to balsamic, declining fluid tide, eliminative and resting phase. Optimal for fasting, cleansing, and eliminative therapies, good for surgery if waning.